Well, the first thing that I had to do was figure it out for myself, because I moved from a different field to working in health promotion, and to really understand that it is a completely different approach. We weren't coming in with a product and trying to sell it. We were looking at a grassroots approach. So talking to people, finding out what they wanted, and then building on that. And that was different, and it's different for a lot of organizations, because often we go in with a pre-prescribed set of rules and programs and say this is what we're bringing and ask people to buy into it. Whereas with health promotion, we're really asking people to identify what the gaps are in their community that would make their whole community healthier and a place of wellness. And it's looking at things that aren't ordinarily looked at in health, like looking at the structure of your community and the economic environment, how easy it is to walk to school, those kinds of things. It's a very, very different approach to looking at health. So it was a lot of educating people, and it was a lot of taking the term health out of it, but really looking at a wholeness model and what makes our community work on the whole. It was a little confusing. One of the first things I had to do was reestablish who my contacts were. I had worked in this area for a number of years before I started with Healthy Alberta Communities, so I knew a lot of the organizations. Population-wise, it's not that great of an area in the whole southeast corner, but it's different when you go from working in one area of human services to another, and health promotion is a little bit different. So I had to really look at who I had been working with and talk to them about what they did in terms of health promotion, and attend a lot of networking meetings, a lot of established organizational groups, to see how that would fit with what Healthy Alberta Communities wanted to accomplish. The other thing that I had to determine was the boundaries. How far were we going to reach? Was it just going to be city proper? Were we going to go outside of those limits? Because we followed the Keep Your Body in Check project, and they had very distinct limitations on where they went. We had to really look at that and see if it would work for us. So establishing that we were including the town of Redcliffe and some of the county, but how far that went, and looking at what organizations that would involve. Within the City of Medicine Hat, there are city-specific organizations, but it's also regional, very regional. So a lot of organizations work far beyond the city limits, and you have to take that into account if you're going to partner with somebody, how far their limits go and if ours are the same, and can we work together, because they may serve different communities than we serve.